I'm going to start with one question. I'm going to ask the committee if they have questions to begin to line up, and we'll go from there for a few minutes. My first question is, oh, I'm sorry. My first question is, how in the world? Yeah, it was visual media. You know what I mean? There was no audio. We just, the question that I have for you guys is a tough question. We talked this morning, Ellen talked this morning about the fact that the age of 12 got kind of stuck in stone about 35 or 40 years ago. And we're still there. We're still working around it. And yet all of the evidence today is that certainly, as Jennifer pointed out, those ages between 12 and 14 are a lot more similar to the younger part of the crowd than the older part of the crowd. And I just wondering where your guys' heads are at, or your industry heads are at, in terms of beginning to really cope with this emerging and very tough issue. We know you've responded very well to some of these other things, but this one is really going to come next. And I don't know who of you would like to start with that fun question, but if one of you would, that would be good.
Thinking.
Well,
Go ahead,
I would
Jill.
say we're still trying to get the under 12 part right. And, as I said, we think there's room for improvement, because there always is, in doing that. I don't see doing 12 to 14-year-olds, including them in self-regulation, on the immediate horizon. Historically, the ad industry has focused on children under 12. And I think as children grow older, they have other rights and responsibilities. And I think it would be difficult to treat all teens like they were toddlers. And I recognize that maybe you're only talking about up to 14 here. But I still think that would be an expansion that I don't see food companies willing to support right now.
So your thought is, at this point, there isn't any real willingness or any evident willingness to begin to grapple with this issue.
I'm always willing to talk to the companies about it, but I think our focus really has been on this under 12 group and not total ad exposure, which Jennifer talked a lot about, because we think that's the most important exposure for kids, ads that are designed to be appealing to them. And COPPA only does 13 and under, and I think going up to 14 would be new and unprecedented. And not that new and unprecedented things aren't useful from time to time.
I thought that's what marketers do.
Right. But I don't see it right now. I'm being honest with you.
Sure, no, I understand. And look, I know it's a tough question, but I think it's going to be a question that comes at you more and more and more. Either of you two, Kathy?
Oh.
No, go ahead.
Okay, I could start. And again, I'm speaking really from my perspective, but what we really try to do as a company is to motivate the folks that we're reaching, so kids predominantly and families, to make healthier lifestyle choices. And with our networks, it really does come to, again, understanding the business and the audience and the consumers. With Disney Channel, Disney XD, for example, who do reach that tween audience, we're sort of going a little bit above and beyond, I think, now to limit the ad exposure even to that audience and apply that same discretion to online, radio, and other touch points under those banners. Above and beyond that, I think it's interesting for me to hear this conversation today, and it will keep us more acutely aware of this particular dialogue, and something that we could go back to our business leaders to understand who their audience is, how we might be able to make a difference. So I think it's an iterative approach, and it's not to say that it will never happen, but I think it's good to listen to the dialogue and see what is coming down the horizon to see how do we get ahead of it. So in short, I think from my perspective, it seems like we're sort of getting there by the very nature of our networks and their reach. And hearing what other issues are coming up will help us do more of kind of what we're doing and possibly even expand for the future. Again, it's a long journey, and it takes baby steps, and you need to know what's working so that you have permission to then do more.
Kathy, you want to add to that?
Well, what I was going to say, so much of what I shared was what our in-store dietitians and health and wellness marketers are doing in the supermarkets. And that 12 to 14 age group is the perfect age group for the cooking classes. And we see, you know, when we do cooking classes in our stores, they're not age specific always. Yes, there are some geared directly for second graders or whatever, but it's that 12 to 14-year-old age group that you really, being a mom of two teenagers, they really start to get involved in the kitchen and start determining what they're putting on those plates. So I think it's a perfect opportunity for the retailers.
You want to, I've got, go ahead, Mary.
David, could I elaborate just
Sure,
for a second?
please, Elaine, go ahead.
What I was going to say is because we're looking at child-directed programming as 35% of the audience, so there might be 40 or 50, there's clearly others in the audience as well, and they could be older brothers and sisters, so it could be this tween age group. So I think that the efforts our participants are making with the under 12 group may have a halo effect for that tween group as well. So if they're seeing quick serve ads where only apples and milk are being shown as opposed to fries and soda, hopefully it's helping to popularize those types of products. When they see cereals where, you know, the box may be the same as it was before, but what's inside has changed, and they're eating cereals that have less sugar and more whole grains, more fiber and calcium than before, hopefully that's adjusting their taste buds too to eat healthier in the future.
Well, I think that's an interesting point. I think traditionally we see that the tail is the younger tail is going down, where kids watch older kids programming designed for older kids and deal with it, but maybe it works the other way too. Mary, let me start with you.
Okay, Mary Story. Each of you talked about progress that was being made in your particular sector, but I was wondering, what would you say that's not being done now, that's not being supported, that could never be done in your sector right now, that you think could be done, that could really truly be transformative in reducing childhood obesity?
Who wants to start? I told you you get the fun question. Jennifer, why don't you start, and then we'll go to somebody else, because I know you have some thoughts about what's the most important thing to do.
All right. Well, as I mentioned, the 12 to 14 is a really important age group. I think also looking at the entire content of the advertising, not just the audience. So, you know, yes, it's true that older children are watching younger children's shows, but I think more younger children are watching older children's shows. And one point I didn't show here is that since the CFBAI started, the exposure to candy advertising among children has gone up about 35 or 40%. So this is an example where the advertising is being shown on programs that aren't 35% children, but lots of children are seeing them. And also the packaging, and we talked about integrated marketing today. The package has QR codes and other devices to send people to the website, to the Facebook page, and that isn't covered as well by industry pledges.
Heather?
I will go next. So it's interesting because we represent one media company, and I know Elaine is representing CFBAI, but that still only covers so much of the market. And so I wonder what can be done to create consistency with advertisements in multiple media environments. So that's sort of a question mark in my mind, because I know we've made a step now this year for food advertising standards to kids from a media perspective, and I know CFBI has done so in a food manufacturing perspective, but again, it doesn't cover the whole pie. So curious what can be done to do that, cover that whole pie.
Good point.
Okay, well, our efforts were really designed to support the efforts of parents and schools in building healthier diets for their children. We didn't think that food advertising is going to really change what children's diets, you know, because parents are going to decide what they actually purchase for the most part. So we think of this food advertising as being supportive of parental efforts. And one of the things I think would be really, really important is something that was in your 2006 report and which Ellen talked about, which still hasn't been done, which is to have a massive social marketing campaign that would help educate parents. I mean, I still think that parents are confused about what healthy eating is. IFIC does research showing every year that most consumers don't know what calories are, let alone how few or how many to eat. And I think, curing the information deficit alone probably won't do it, but we need to address it, because I think all other efforts are going to be hampered in their ability to succeed until we address that information deficit.
That's a good point.
And I mentioned in our remarks that on a retailer side, health and wellness is looked at as a huge competitive differentiator. And I think that sometimes prevents us as an industry from looking at what's working, what doesn't work, because you're holding some of that information tight. And I think we're starting to see more and more of our retailers wanting to share those best practices, so as an industry, we become known for that destination for health and wellness and good opportunities for parents and kids. So I think just more of that I'd like to see.
Shariki.
Yeah, thank you. My question is about profit and the effect of price on what consumers buy. So right now it seems that two of you, Kathy and Heather, have talked about selling health and wellness in a way that can be profitable. But in general, the sense is that the food companies need to sell the unhealthy products, even though they're willing to make some compromises with younger children, but that this is a core part of the business model, is to sell the unhealthy products. And so I'm encouraged to hear that maybe that doesn't have to be the case if you can get ahead of it. My question is actually for Kathy about, in the beginning of your presentation, you had a comment that couponing and circulars were things that are very important to supermarket shoppers. But you didn't actually say how you're using that discounting to drive people toward the healthier products. And so I'm wondering if you could talk about how those two fit together.
And I don't have statistics with me, but I can tell you especially within the companies that I've shared here and with many, many of our members, they're starting to use their circulars with the better for you choices, using the dietitian front and center in some of the circulars that go out over the weekends, tying that back into their website so that it's not just touching the person in the store, but it's building that relationship that I think the supermarkets are so good at of doing in the communities, whether it's our large national members or our small independent members. I think it's that building of the relationship that will really carry through. So hitting that in the circular, hitting that in-store with messaging, I think is a multifaceted approach.
David, if I can follow up, because
Please.
The question is, I mean, there are two ways this could work. One way is to build that relationship and sell the health and wellness so that people are willing to pay a premium for the healthier foods. The other way is that you would actually find a way to sell the healthier foods at a lower price. And I'm really interested in those, in those two, because some people can't afford. Oh, someone's calling to give you the answer. Right?
Thank you, God.
Call is important to us, right? Yes.
Well, and to go back to that, and I think, one of the things that our members are doing, and I put up the slide about private brands too, is to be able to work with their customers to say that eating healthy doesn't have to cost more money. And I think that's a big piece of what our members are trying to convey in the stores when folks shop. So it doesn't necessarily, some of our research hasn't proved out that it costs a lot more to eat more healthfully. So, again, I think it's using the coupons. Catalina Marketing, who did that survey, did a program with many of our members called Simple Substitutes, which was all about giving, if someone bought a full-fat butter, giving them a coupon for an omega-3 olive oil-based spread that you could use in return. So I think you'll see more and more of our members going down that path.
I forgot to say, as I was supposed to, as you ask your question, if you would please say your name and your affiliation, that would be good. Go ahead.
Sure. I'm Monifa Bandele. I'm from Moms Rising. And first, I really want to hammer home that 12 to 14-year-old discussion, just to really put a pin in it, because it comes up constantly in feedback from our members from all over the country, that middle schoolers in particular have a tough time, even more so than their younger counterparts and their older counterparts. They're really in a very vulnerable position and highly influenced by marketing, we find. But my question is, we're always interested in how to grow these progressive steps that industry makes. So to Heather and also to the rest of the panelists, what made you do it? What happened in 2006 that made your company say, we're going to take this step, or these gradual steps forward? Because I think that's very important to help us understand how we can grow what's happening at your company, and like you said earlier, cover that whole pie. And if you could also, with all the three, what was it that was the tipping point that kind of made those organizations decide that they would take a step in the right direction?
Sure. So as I briefly touched on, kids and families have been at the heart of everything we do, and our commitment to them is really part of our brand identity. So inherently, by the very nature of what we do and our brand, they've been our focus. And it was, I think, in early 2005, in focus groups especially, we started hearing from parents that they really needed help getting their kids to eat better. And that's also when we started seeing the evidence of a growing epidemic. I think there was a quote that was published in the New England Journal of Medicine that said, that this was the first generation that was expected to live shorter lives than their parents. So as a company that has kids and families, core to our brand, we knew we needed to be part of the solution. We knew it wasn't going to be us that would be the solution solely, but that we could definitely play a part and a role. And it really helped that our CEO, Bob Iger, really got behind this and made it a company priority. It helped that also we continued to do more research so that we could have conversations with the business managers across the company so that they could really see that you can do well by doing good. Because at the end of the day, they also have to, drive their P&L and make sure that their businesses are sustainable, both from a financial standpoint, but also from a brand equity standpoint. So it started with, I think, the research and the facts. It continued with the commitment from our very top leadership. And then it really sort of spread because we knew how to talk the language of our business managers.
Kathy, you want to add to that?
Absolutely. And one of the reasons I'm at FMI is because of our members requesting an increased presence and a focus on health and wellness, knowing that they really have a place to play in their communities. And I think that's it. You see so many of our members really committed to that community being a safe place for folks to go. 2.2 times per week, the average consumer goes through a supermarket, so there's a lot of interaction. As Heather said, commitment up to the CEO level of all of our member companies personally to get involved. We have many companies trying to be part of the state's solution to be the healthiest state in the union. A little bit of competitive juices going out there now. So I think it's that commitment to the communities where you operate, the commitment all the way up to the CEO level that's so important.
Let me just a quick follow-on to that question, and then we'll go to the others. You get feedback from your customer. You both, your clients and your customers are face-to-face with you guys all the time. And they're face-to-face with the consumers all the time. Are you getting constructive and positive feedback for the positive steps that are being taken that convinces you that you can continue to expand this? Obviously, you said some of that was going on, Heather.
Yes, absolutely. And we continue to do research in this area, both qual and quant, to understand what are the things that are resonating with our consumers, with our guests, with our audience? What are the things that are really helping them achieve their goals as families? What are the things that we can do more of? The nutrition guidelines were a start, and they're the engine that drives everything, but so is the intimate conversations we have with our core audience, core consumer, core guest. And again, that's another reason why we've been able to sustain our commitment, because it continually keeps top of mind to our business leaders and business managers why this is important. It's the right thing to do for families, but it's also the right things to do for their business because of their consumers.
And are you trending up, Kathy? I won't ask you to go into great length, but do you see more and more of this happening?
Absolutely, yeah. We see it across the board with our stores, and probably half of my week is spent talking to some of our members about looking at corporate structures to put together the right in-store, organizational chart, who should be involved in the teams of health and wellness. We just put up this year a Center of Health and Wellness on our website that brings together an implementation guide from the smallest players up to the largest players of how do you get that strategy, how do you determine what your strategy is to deliver against health and wellness, how do you create the team, how do you get senior management buy-in if it's not already there. So a lot of commitment and certainly a growing area.
Sir.
Hi, my name is Steve Terrett, and I'm a member of the Standing Committee. Thank you very much for your really interesting presentations. I have a question for 3 of the panelists, so I'm excluding Jennifer from the question. You've taught us, and thank you for doing this, that your companies have created corporate expectations for their behaviors, and that they've also met those expectations. And having met those expectations, it conferred a health benefit on children, which I think is all wonderful. So given all of that, would your companies now be willing to see those expectations that they've themselves developed be memorialized by regulation? And if not, why not?
I could start. We believe that companies need to adapt to what works for their consumers and their business model, and I think that's something that I touched on. It's wonderful, I think, to see so many efforts being made, but one thing that might work for a food manufacturer might be different than what might work for a media company, and what might be different than possibly someone in food service or travel and leisure. So I'd say that part of, and I might be biased because I work in a creative company, so I see Imagineers come together with writers and creative folks and see sort of the magic that happens when you do get multiple perspectives in a room towards one goal. We believe that we've been successful because we've been able to do something that works for our business, for our consumers, and for within our business model. So would think that the right thing to do is to continue to allow that kind of creative development to happen. But that's just an N of 1.
Yeah, and let me just add on to that, because as one of my slides showed, the Food Marketing Institute and Grocery Manufacturers Association partnership on Facts Up Front is a voluntary program that was in response to potential regulation. What we're able to do with creating Facts Up Front ourselves is to make sure that it works for our environments, it works for our stores, it works for the consumers that are shopping in our stores. And I think, again, it sparks that competitive advantage out in the field that just makes it get better and better as more people use it.
Right.
Well, having worked on government regulation for most of my life, I'm a fan of it in its appropriate place. But having also worked on KidVid and having now worked in self-regulation, I think that self-regulation works better in this arena. And I think that my former colleagues at the FTC would agree with me. I don't think that they're in any rush or eager to regulate in this area. It's a very, very complicated area, as everyone here has explained. And companies are at different places in their reformulation efforts. They have different resources available to them for R&D. They may have different needs for longer implementation periods or shorter ones. It's really hard to do a one-size-fits-all regulation that would work well in this arena. And the FTC is very supportive of good self-regulation, which they define as independent, accountability, and transparency. And we provide that. And one of the benefits that they see with self-regulation, and I see as well, is that when industry participates in setting the expectation, you can find really, really high compliance, as high as or better than you would with a government regulation, because they actually work to set it and they have bought onto it. So I don't think they would be willing to do that for the foreseeable future.
Okay, we have 2 more questions coming, and we have 5 more minutes. So if you could make your questions short and then make our answers short. Go ahead.
Hi, Ingrid Kolstad, also with Johns Hopkins at the Center for Human Nutrition. This is a question for all of you, but mostly for Kathy. This was a very interesting trend that it's actually financially or lucrative, sustainable trend to have dietitians in supermarkets and other areas of life. I had a few questions before I can fully get behind it. One, I wanted to know whether the public, the consumer, sees this as a substitute for seeing a dietitian that their physician may have recommended. Has there been any way of assessing the public perception of seeing a dietitian at the grocery store? Two is, are they, dietitians can make a lot of recommendations under that umbrella. They could make changes from choosing one children's cereal to another children's cereal, or they could write recipes for Swiss muesli and how to make oatmeal cereal at home. I mean, are they obligated to push people towards using fruits and vegetables and break down the barriers to having them use fruits and vegetables? Or are they trying to promote certain products that might be an increment better? And thirdly, sorry, it's a short question. Are they promoting dietary supplements and giving what some might view as medical advice within the grocery store chains? Thanks.
I wrote them down, so I'll go in order. The RDs that I see working in store, you know, we don't have the data to tell you if a physician recommends someone see a dietitian, that they're going to see the supermarket dietitian as opposed to a different dietitian. However, you know, those are licensed professionals. A dietitian, whether you're practicing in a supermarket, in a hospital, somewhere else, are licensed professionals. Just like I'm a licensed pharmacist, I have an obligation, you know, to do the right thing from a nutrition standpoint. So that doesn't concern me that much. Your second question was about RDs promoting certain foods that might be on special. And I think what I'm seeing is when registered dietitians are being employed at the supermarket, they're being employed to talk about health and nutrition. And, you know, certainly some food, you can have fun and there's some foods in moderation, but they're really there to teach parents, teach kids how to incorporate the MyPlate guidelines, the USDA dietary guidelines into everyday life, not to overcomplicate it, that it's a really simple thing to be able to do. So I think they're there for the long-term good of the nutrition of the shoppers in their store. They're nutrition focused first and foremost. Dietary supplements, that's an interesting question because we just partnered with the Council for Responsible Nutrition and published a paper that talks about the appropriate promotion and advertising of dietary supplements, what you can and can't say if you are a person working in a supermarket. If you're a pharmacist, you have one level of what you can say, and the rest of the folks in the store have to watch a little bit more what they're saying. But in some of our stores, you saw one picture from Giant Eagle Health and Wellness, where the pharmacist, the dietitian, and some nutritional experts are actually all working in a wellness center together, where the supplements are out in front of the pharmacy area, and then the fresh fruits and vegetables are across the aisle. So it's that team approach that I'm seeing a lot more of in the supermarket. But I would hope that they're all following the do's and don'ts of what you can and can't say about dietary supplements.
Joe, last word.
Sure. Joe
Last
Thompson,
question.
member of the committee. I want to thank all of you, especially our three corporate representatives. And my question really is targeted to you. It comes around about how strong a penetration do we have in all regions. We've had over the decade a growing awareness, development, political responsiveness of corporate leadership. But do you guarantee that when your corporation makes a decision, it's true in every Giant, in every Walt Disney store, in every member of your association, down to every retailer in the local community? Or is it just a superstructure conversation we're having now?
I can tell you that, again, with my role at FMI, we have a CEO-level health and wellness committee, which it's comprised of some of the most passionate CEOs I've ever been fortunate to engage with. So I think it starts at the top, and it's that conversation that if their corporate culture is not there today, I think they're working very diligently to make sure that it trickles down. And you'll see it in some companies, they're actually working on employee health and wellness to make sure that everyone's walking the talk in the store, from the clerk all the way up, so that that translates to every conversation they have with their shoppers.
It could be beneficial to have more than just the conversation about trickle down, but to see whether there actually are explicit directives that penetrate down, not just trickle down.
I'd add, oh.
Go ahead.
Okay, I'd add to that. I absolutely agree. It's great to have the most top leaders of the company really internalize the commitment and help spread the word. But in order for the commitment to touch all employees, it really does take time, and it takes a lot of coordination. So we also have steering committees at multiple levels of the organization. We have various kind of one-sheets is what they're called, that go to various employees with our goals and our the strategic sort of pillars of our commitment. I just recently was reviewing in preparation for the Mickey Check and some of our parks initiatives, some of the educational materials and speaking points for members of sort of the front line, the people who work in our parks and our resorts. And then we also have HR initiatives for employees. And we're starting to see how we can get employees involved even in the Magic of Healthy Living efforts, in addition to overall health and wellness efforts. We just participated and had a large presence at our health and wellness fairs that happened last week. And employees came up to us and said, I know about this initiative, I'm so excited, and I'm so proud to work for a company that does this. So I think there's a pride thing that employees will get behind. And the more employees get to know the commitment, it's not too long before they sort of have a pay it forward approach. But it takes time, it takes coordination, and it takes dedication that, you're in this for the long haul, and you're going to continue to try new ways to spread their message.
Elaine, I know you guys are big on following up on this. Go ahead.
Yeah, and the companies are very good on it. They've all done internal training, and they do it every year, and the self-assessments they do help them pinpoint where they might need to redo it. One company actually had an online quiz. The first thing that popped up for the relevant employees when they walked in the morning was a quiz about their pledge commitment. I thought that was a great way of communicating it. Others do town meetings, so they really do walk the talk, as you say.
Yeah, and I forgot about the trainings as well, which we also take part in and lead, so that we reach more people in the company than just top leaders.
I want to thank all of our panelists. You've done a great job. Thank you.
Thank you.
Turn this off.
This is a short break, so we'll reconvene at 2:30 so we can pick up on the final panel.
Have they said it?